Sara Grethlein, and I am a professor of medicine, hematology, and oncology at the IU School of Medicine, and the medical director of the Joe and Shelly Schwarz Cancer Center at IU Health North. To talk about the Schwarz Cancer Center is really to talk about an exciting new future for the people of this area. We're so excited that it's going to really be serving the patient in a holistic way. It's an 88,000 square foot facility. Walking through it, I'm continually amazed at how big it is, but it is also small enough to be warm and community focused. I think the teamwork is really one of the most important things that we've been striving to provide for patients. We are using nurse navigators to help the patients and walk the journey with them from even before they get to the cancer center. They'll establish a relationship with a nurse navigator who will help them prepare for what the experience will be, what they can expect, and will guide them along their path. From a programming perspective, we will have a top-notch brand new radiation facility, not only for what we call external beam radiation, but also for brachytherapy to provide radiation directly to tumors and minimize side effects in the appropriate patients and situations. And we're really focused on supporting the patient along their journey from the cancer treatment perspective, but also from the psychological perspective, the nutrition perspective, the financial perspective. We've really put a lot of thought, a lot of listening to what patients have said they need into building and designing this program and the facility. I think the reason that we've selected Carmel for this facility is that it's the heart of a thriving and growing community. We've got not only Carmel, but Fishers next door, Noblesville. These are some of the fastest growing areas, and when we looked, a major deficit here was the absence of a radiation oncology center. When someone's going through a complex cancer journey, they're often getting chemotherapy and radiation at the same time, and having to travel to 2 different facilities every day or to see doctors in multiple locations adds to the distress and challenges for a patient, and we're trying to minimize them. Up on the 2nd floor of the cancer center, we have slots for 22 patients to receive cancer therapy. 16 of those are in the bright, airy common treatment room with privacy provided by sliding wooden doors, but big, airy, great windows. And then we have 6 private rooms for patients who either are feeling unwell or have an infection problem or prefer their privacy to receive their treatment in an individualized space. So I think we've really, again, listened to the patients all the way through this journey and their families to try and meet them where they want to be met. And that goes to our naming donor. So Joe and Shelly Schwarz are the naming donors for the Cancer Center. Shelly walked beside her husband on his cancer journey, and she remembers vividly what made the difference for him, what helped the 2 of them feel supported, whether it was getting IV fluids or having a same-day clinic, so that we don't need to send as many of our patients to the emergency room. We will have a nurse practitioner on site for our patients Monday through Friday during business hours. So instead of sending you to the emergency room to be evaluated for your pain or your nausea or your dehydration, I'll have a cancer-trained staff partner who will see you and manage your symptoms and other issues right in the cancer center. So we're really trying to do what we can to keep patients in their home environment, out of the emergency room, as well and as vibrant as they can be along this journey. We also, in mid-2020, will be opening our adolescent and young adult unit, which will be the only one in this region. And that's in partnership with the physicians at Riley Hospital. Right now, if you are 14, 16-year-old and you're diagnosed with acute leukemia, the most common cancer in children, you don't want to sit in the waiting room with kids in the pediatric unit, and you certainly don't want to sit next to the elderly. Meeting the needs of that population of adolescents and young adults is really critical for us. What kinds of things are different for that group? Well, other than having their own space, and anyone who's had adolescents knows they like their own space, but we're going to have experts in helping with fertility preservation. So whether it's for pre-puberty children or for adolescents, making sure that as we're curing their cancer, we're preserving their future is critically important. So we have experts in fertility preservation as part of the program. We're looking at survivorship very seriously. We want to make sure that our patients don't just survive, but that they thrive. So the integrative health program is looking to nourish the whole patient. So whether it's through art therapy or music therapy, through a cosmetology program, whether it's through Tai Chi or cooking classes, or actually one of my favorite things is a workshop and hands-on lesson about using technology. We offer the patient portal, which allows patients to have access to their medical records, to their lab tests, to their radiology reports, but navigating that sometimes, especially for older patients who aren't quite as internet savvy as my kids are, it can sometimes be challenging. And we want to be there and allow the patients to learn how to use all of the tools available, just making sure that they get the best support and that we eliminate all the barriers to a successful cancer journey. I think what I'm most proud of is that we listen to patients and their families and have built the Cancer Center and programs that they asked us for. A warm, inviting, team-based care that will help them along their journey, give them top-notch, current clinical care, access to cutting-edge future care, and full-time, vigorous support on their journey. And between our psychologists, our social workers, our dietitian, our great doctors and nurses and medical assistants and administrative staff, we will be there for our patients.